soldier, husband, father, son. Labels. We all have them for better or for worse. On September 12th, 2019, my husband donned a new label, cancer patient. This fit, robust man with 22 years of service in the Army who dodged the family disease of diabetes, which none of his 5 siblings were able to escape, was now sitting in his doctor's office hearing the words, "You have alveolar rhabdomyosarcoma, and it's in stage 4. Alveo what? Rhabdo who? Was his response. From that day, it felt like the wind was snatched from us. We were the perfect couple. We finished each other's sentences. We had 3 children and a dog. We had the fairy tale life. We had plans for the future, and life was good. I too had labels: veteran, wife, mother, business owner. And now I had a new label: researcher extraordinaire. I researched everything I could get my hands on to learn about alveolar rhabdomyosarcoma, ARMS for short. I solicited the help of others. We sought the assistance of many holistic and allopathic practitioners. We ruled nothing out. We knew that my husband had a grim diagnosis because this was known as a childhood cancer. And there have only been 400 cases of ARMS in adults in the last 30 years. Doctors really didn't know how to treat it in adults, but we had hope and faith that he could be cured. Although his situation seemed distressing, he always had a positive attitude. No matter which hospital we were in, and we were in many, he inevitably became the celebrity of the floor. In fact, doctors and nurses alike would come in on their days off just to see how he was doing. Caregiver. This became my newest title. I spent every night in the hospital with him. I never left his side. Because his case was so rare and so complicated, I made sure that the nursing staff got the correct report from one shift to the other, because oftentimes they did not. He said having me by his side helped him better work on healing. That was music to my ears. Then COVID hit. It was like when the planes flew into the Twin Towers. You never forget where you were when that occurred. At the fall of COVID, we were in Cincinnati, Ohio, awaiting his radiation appointment. He barely made it through. He began to vomit everywhere. I rushed him to the hospital. I always kept a duffel bag of clothes in the car, so I was fully prepared to spend many nights there. As I pulled up to the emergency room, I was greeted by a worker in full protective gear who instructed me not to get out of the car. He asked my very frail husband to open the car door, of which I had to lean over and open for him. He sat my husband down in a wheelchair and whisked him out of sight. Now, we were wearing masks long before it was on trend, but I could see the fear in his eyes. He had that ability to know when things would not be good and when they would. Stunned, I slowly pulled off. I gathered my emotions as I went back to our hotel. The doctor admitted him, but I didn't hear from her for 3 whole days. My husband called me and said he felt awful and that they were not giving him his proper meds, but wouldn't tell him why. When I spoke to the nurse, she said, "That's what the doctor ordered." Certified integrative nutrition health coach. That is another label that I have. With this label comes an experience as a laboratory technician in the military. The lab works closely with the pharmacy. I had him send me pictures of the meds they were trying to give him, and sure enough, the med given in relation to his condition was contraindicated. They tested him for COVID 3 times, and 3 times it was negative, yet they isolated him, they refused to give him his meds, and I felt helpless to do anything. That is when I started working on getting him a transfer out of that hospital. He was a cancer patient, not a COVID patient. No fever, no cough, no runny nose, no sore throat. He had cancer, a rare cancer. Why wouldn't they take the time to read the chart? Why wouldn't they take the time to listen to him? To me, he was not a number. He was a patient. He was a human being with a family and feelings and needs, not a body in a bed in the middle of a pandemic, and not a statistic. When the doctor finally called me back, she stated that she thought he had COVID because he had spots on his lungs. I really tried to keep it together. With all of the calmness I could muster up, through gritted teeth, I said, he does not have COVID. He has alveolar rhabdomyosarcoma. She wouldn't listen and labeled him a COVID patient anyway, which meant the prison-like conditions with which he was living would continue. As I called to have him transferred to a hospital in our state, they said they would not take out-of-state transfers for fear of spreading COVID. All I could do at this point was just shake my head and bring my husband home to die. Widow. That is the latest label. April 12th, Easter Sunday, 2020, he left this world, and not one doctor on his team called to see how he was doing. Not one, except for a sweet urologist who operated on him the summer before because she heard he passed away. All of the other doctors labeled him as a number, a medical bill, a COVID statistic. Even his funeral was not COVID proof. A man who touched so many lives, who was willing to give his life for his country, was only allowed 10 people at his funeral with no military honors of a 21-gun salute. From this pandemic, I learned these lessons. Number one, fear is a powerful emotion. It can cause behaviors otherwise unseen in the human predicament. Lack of information or false information can make these erratic behaviors seem normal. 2, caregivers. Although with the patient for every doctor's visit, every chemo infusion and blood transfusion, and every in-home treatment still in most cases are not considered by healthcare professionals as credible sources of information. And 3, patients with conditions outside of the pandemic-specific disease, whether they mimic the disease or not, receive subpar treatment or are lumped into the pandemic disease category, which in a terminal case like my husband's can lead to a lesser quality of life and ultimately faster mortality. We use labels like COVID, pandemic, patient in room number, whatever. Instead, we forget that these are people with families, feelings, and possible futures. When did we stop seeing the person and only see the patient occupying a bed? When will we understand that a pandemic does not eradicate all other forms of disease that need full and proper attention as well? We can't throw medical books and common sense out the window just because we are in the midst of a pandemic. So my most important lesson learned is that there are many pandemics going on. Of the most serious is what the outbreak does to the mind. It produces a lack of compassion and self-preservation at all costs. Maybe, just maybe, we should create a new label, visionary, but not the one that can see into the creative ideas of the future, but the one that can see beyond the condition and care for the person presented right in front of them. Thank you.